ABC612, ABC Radio Brisbane and Queensland. On air and streaming on the ABC Listen app.
This is Sarah Howells.
Now, a lot of people who suffer from migraines also have a temporary change of vision that goes along with it. If you've experienced it, maybe you know what I'm talking about. It can look like zigzags or blurs or just gaps in your vision. The scary thing is, though, that this change in vision is very similar to the change that can happen when you're having a stroke. So how can you tell the difference? Julie Newport is an optometrist with ICU Optometry. Good afternoon.
At Barton.
Yes, there you go. What are the main differences in change of vision between strokes and migraines?
They can often be very, very similar. So if you've got a bit of blur that's temporary, or if you've got a little bit of doubling that's temporary, and I'm talking about seconds to minutes, like maybe up to about 20 minutes, those two visual symptoms are actually common to both stroke or more commonly known as transient ischemic attack or TIA, a mini stroke. If you've got zigzags in your vision, though, and people will be nodding along while they're listening to the radio going, oh, yeah, I've had that, and they're very, very, very clear, and then just kind of expanding out to the peripheral vision. Or if you've got little sparkles in your vision, you're looking at some print, and it just looks like little tiny bits are missing, that would be a migraine. Zigzags are a migraine. Kaleidoscopic vision is a migraine. But if you've got it's just blanked out altogether, even if it's for a very short time, you need to consider, is that a transient ischemic attack? Is that a stroke? Should you be doing something about it now?
Right. And are there any other physical symptoms that can be a point of difference?
Very much so.
Okay.
So, of course, not everybody will get these. And so often in my industry, we're faced with somebody who is telling us that they've just had all these symptoms and they could be either migraine or stroke, and you don't want to get it wrong. If you do get it wrong, because any health industry can have that happen, if you do get it wrong, you want to make sure that you've erred on the side of caution. Yes. You don't want to say to a stroke sufferer, that sounds like a migraine, just go home and have an aspirin. You want to waste somebody's time if you're going to get it wrong. So you want to say, no, that sounds like a stroke, have them go to the hospital immediately, and then they can work out at the A&E department whether or not it was a stroke. And then the worst thing you've done is to waste that person's time and money. And whereas otherwise, the worst thing you can do is actually cause somebody serious harm or even cause them to die.
Yeah, so the outcome can be, it's very important that we get this right. And as you say, err on the side of caution. But we also don't want to freak ourselves out every time our vision goes a bit funny, right?
You want to be alert and not alarmed.
So are there other symptoms that are kind of common between strokes and migraines in addition to that?
Yes. So a lot of people will get severe headache in either stroke or migraine. People are known to have nausea and vomiting as well, or they might feel numb. The numbness is probably more along the lines of stroke rather than migraine, but you can actually get it in both. People can get a bit confused. They might have difficulty speaking. They might have difficulty hearing. And they might, even in a migraine, have weakness down one side. But if it were me, or if it were, somebody I care about and they had weakness down one side, I'd be saying that's a stroke until proven otherwise. One of the visual things that is a distinct point of difference between migraine and stroke is just a total blackout of your vision, even if it's just for a short time. And that needs to be taken seriously, even if the person feels 100% well immediately afterwards. There's a nice little acronym that they use out in the healthcare world. Well, I'm part of the healthcare world, in the stroke world, FAST. So if you suspect somebody may have had a stroke or maybe is it just a migraine, then you ask them to smile. And if they smile with sort of only half their face, that's more likely to be a stroke than a migraine. If you get them to raise their arms, A for arms, if one of the arms can't be raised as high as the other one, that's a stroke until proven otherwise. Also, if you get them to actually say something, so speech, if you get them to repeat a simple sentence back to you and it comes back slurred or just weird, then that's a stroke, not a migraine, until proven otherwise. And be still prepared that you may have got it wrong. And I can't stress it enough. There's only one way you want to get this wrong, erring on the side of caution. And the T in FAST is time. Get them to the hospital immediately.
Because often, I guess, we like to think things are fine and we like to go, it'll be all right. I'll just give it another hour. We'll just see how it's going. But maybe not a good idea.
Sometimes we live in a Pollyanna world.
We
Not
hope
a good
for the
idea.
best,
Yes.
but plan for the worst.
Yes.
Right. So if you do believe it's a stroke over a migraine, obviously getting to your emergency department, getting to the nearest hospital, what else can you do?
That's it.
That's it.
Go. And one of the most important things to realise is even if you feel 100% sure now, if you're not 100% sure that that was just a migraine, you need to know that if it was a TIA or a mini stroke, that you're very likely to have another bigger one over the next few days. They'll be able to work out at the hospital or the stroke unit if it was indeed a TIA or a mini stroke, and then they can put things in place so that you don't get that big one, and that has just saved you some major health problems or death.
Yeah, wow. And it's interesting because those symptoms are so similar.
Very similar. It's quite scary.
Is there a correlation between getting migraines and a stroke risk?
Not to my knowledge. I'm happy to be corrected on that, but not to my knowledge.
Yeah, okay. So what else do we need to know about, migraines versus strokes and all of this sort of stuff?
Okay, well, the other thing is, again, if you've looked at all of those and you've gone, no, it still could be either of those, and I don't really want to go to the hospital, I don't want to waste my time, start thinking to yourself, is there a family history of stroke? Am I a bit overweight? Do I smoke? Do I have diabetes? Do I have a fair bit of stress in my life? Could I maybe exercise a bit more? Do I have high blood pressure, high cholesterol? Do I maybe drink a little bit much and ever had clots before? Any of those, that's a stroke until proven otherwise. Go and get it sorted out.
All right, you heard it here first. Well, probably not first, but you definitely need to make sure that you check it out. Julie, thank you so much.
You're very welcome.
Julie Newport there, an optometrist with ICU Optometry. And there you go. A few tips. If you're not sure, head to the emergency room.
Sarah Howells
Now we're talking.
on 612 ABC Radio Brisbane and Queensland.